Bill scenario highlights the type of barriers and bias that can occur in treatment services. While the clinical scenario actually occurred in the 1960s, these exact types of issues still persist today. So in this PowerPoint, we are going to explore barriers and bias to services and what we as providers can do. Let's look first at barriers. What is a barrier? Barriers are considered to be characteristics or events that restrain or serve as an obstacle to treatment and the recovery process. A barrier is often broken down into two dimensions: internal, meaning something that occurs within an individual, and external, meaning an outside influence. The concept of internal barriers relate to a person's perception. This can be a perception of themselves, others, or the treatment experience. Some examples are motivation, stigma concerns, own recognition of addiction issues, beliefs as they pertain to addiction issues and/or what it might mean to go to treatment, opinions of others, privacy concerns, and fear of the unknown. Any of these may create an internal barrier that blocks a client's decision to access recovery services or complete treatment. Moving on to external barriers, these are barriers that can emerge from a number of outside sources. Examples of sociocultural environmental barriers can include access to transportation, childcare options, homelessness, legal system requirements, and discrimination. Some example of healthcare system barriers can include options and availability, and access. And agency characteristics that can create barriers include service accessibility, provision of materials and services to meet the need of multiple populations, and a specific treatment approach or process that might be required by the agency for all clients to use. These serve to further block either entry or completion of treatment services. Moving on to bias in service, one of the major areas of bias actually occurs in evaluations of clients regarding addiction and mental health services. Regarding evaluation concerns, one of the major issues occurs with bias in diagnosing. In relation to substance use disorders, depending on the provider, clinical training, and addiction specialty training, what can occur are misdiagnosing, making an error in the clinical opinion of the symptoms being evaluated, underdiagnosing, not taking into consideration substance use and/or mental health issues, and thus not diagnosing this area at all, and lastly, overdiagnosing, viewing the person from a pathological perspective and creating diagnoses that are not accurate. In some sense, all of these scenarios occurred with Bill. A second area in evaluation concerns is the lack of understanding and inclusion of cultural concepts of distress, formerly known as culture-bound symptoms, and spiritual influences. Often, missing these can result in more clinical misperception and inaccuracy. For more specific information on these two factors, please make sure to review the articles included in Week 10. So, with the potential for bias and barriers in recovery services, a question exists for us as treatment providers: what to do? One approach is to always review records and clinical information with 5 key questions in mind. The 5 key questions are: 1. Were substance abuse and addiction issues included? Often, these are not screened for and the clinical evaluation can be inaccurate without their inclusion. Likewise, number 2, were mental health issues included? This can be invaluable for us and other providers. As a treatment provider, mental health issues commonly go hand in hand with addiction issues, so being aware of any mental health symptoms and diagnoses a client may have or had in the past is critical for us to know. Number 3, were cultural and spiritual issues included? As discussed in the article, if cultural issues such as cultural concepts of distress or experiences of acculturation and spiritual needs are not included, this can result in an inaccurate understanding of the client, or worse, a type of pathologizing of how a client may present. Whatever cultural and spiritual information we may have knowledge of is critical to include. Number 4, were social and environmental stressors noted? This area is equally crucial. Often we are the ones who have the most access and contact with clients, so we have an inside look at what stressors they might be experiencing. Some of these might include financial stressors, homelessness, language difficulties, family separation or other family stressors, and lack of a social support system. Lastly, number 5, am I aware of medical issues and needs? While other providers may focus on medical areas and miss substance use disorders, addiction concerns, and or mental health issues, on our end as treatment providers, we may not have a complete picture of the client's medical history, which is just as valuable. Whenever any of these areas is lacking, collaborative contact is essential. As appropriate and able, meaning we have a client's permission to share information, making contact with other providers and asking questions about medical issues, mental health issues, and sharing your perceptions on areas including addiction issues, cultural, social, and environmental factors can be crucial. Not only for us as providers in obtaining accuracy, but more importantly, in ensuring appropriate and effective treatment and recovery services for clients. Along with that, it is important to remember what types of provider interventions we can advocate for. One area is the recognition of types of barriers and bias and their influence on clients. With this recognition, we can then specifically advocate for clients at 2 levels. For specific advocacy at a clinician level, here we may serve as an advocate and liaison with other providers or systems to ensure adequate care for our client. For advocacy and intervention at an agency level, here we can work and advocate within our agency and community to bring attention to examples of barriers and bias. In addition, we can make suggestions on how to improve in these areas and advocate for these changes within the agency and community. These interventions, along with knowledge of bias and barriers, help to increase efficacy of treatment services for all clients.